Hi everyone, my name is Sherona Bau. I am a nurse practitioner at Pfleger Institute at UCLA. What are the most recent breakthrough in the management of cirrhosis? This year is very exciting for the liver world because there are few medications approved for liver disease. They are not particularly for management of cirrhosis. However, I can mention a few things here. The AASLD guidelines provides evidence-based guidelines for the management of portal hypertension, particularly for the patient that they have cirrhosis. Primary prophylaxis for variceal bleeding, they suggest to use non-selective beta blockers such as carvedilol. Carvedilol is preferred for some cases because of its vasodilatory effect. They also suggest giving non-selective beta blocker for the patient if they have medium or large variceal to reduce the risk of bleeding. The second thing I want to suggest is transjugular intrahepatic Portosystemic Shunt. This is a procedure to consider for the patient. They have recurrent bleeding from the varices despite optimal therapy, and for the patient who develop refractory ascites. But we will also prefer those patients on a transplant list first, or at least being evaluated for transplant, because there's a small risk for liver failure. So for the patient, they carry the diagnosis of primary biliary cholangitis. They're very exciting because there's two new medications just FDA approved for PBC. So the first one is elafibranor. This medication was approved on June 10. The second one is seladelpar. This medication was just approved August 14. Both medications are not FDA approved for decompensated cirrhosis, but both medications are listed with no dose adjustment for Child-Pugh Class A. Both medication profiles suggest the provider should actually consider discontinuing treatment when the patient develops Child-Pugh Class B or C during the therapy. So the last medication, I think everyone probably heard of it, is resmetirom. This medication was approved on April 9 for MASH. This is the first FDA-approved medication for MASH. However, this medication is so far is only FDA-approved for patients with F2 or 3 liver fibrosis. I'm actually looking forward for the data for cirrhotic patients for resmetirom. So stay tuned. Thank you for listening.